On 20th July 2010, the United Nations General Assembly recognized that the human right to water and sanitation and acknowledged that clean drinking water and sanitation are essential to the realization of all human rights. The resolution calls upon states and international organizations to provide financial resources, help capacity building, and technology transfer to help countries, in particular developing countries, to provide safe, clean, accessible, and affordable drinking water and sanitation for all. But as a result of a high population explosion, about 21 million Ugandans lack access to safe and clean water, and 27 million do not have access to improved sanitation facilities. Climate change also poses a major threat to accessibility of water. The COVID-19 pandemic has made access to water more vital than ever. Sauti za Wananchi recently conducted a national survey on accessibility to clean and safe water. But before I bring in my panelists, let's have the views of the public in this program titled Citizen Voices.
Hi, my name is Isaac. My opinion on water is expensive in Uganda. Water is expensive in Kampala. We have water, the distribution is there. There's access to clean and safe water. But I think the prices are high. Domestic, I think a unit is about 1,800. Commercial is about 4,800. Everything moves on water, washing, bathing, refrigerating. Some of us who have flowers in the compound. If you have 2-3 children, it's a burden now in as far as using water is concerned. So we are really constrained. We have waters, we have lakes, we have rivers, we have rains. Though sometimes they can be on and off, but we have the waters. I think our superiors need to do something in as far as charging us water is concerned.
My name is Mochom William. Basically on the issue of safe water, I see it is a challenge because like when you go to the slum areas, you find that the pipes whereby the so-called safe water is connected into, you find that it passes, the pipes pass through sewer is also passing. So there's no basic idea whether there is clean water or, so the issue of clean water being there, that one I rule it out, there is no clean water.
Ekikwatagana n'amazzi mu Uganda oba mu Kampala amazzi mwegali. Kituufu amazzi mwegali naye bannayuganda ekibaleetera obutakola ki obutasasula amazzi oba okutandika okugabba obubbi musolo gavumenti gwekola ki bwebinika oli omuntu agenda n'abeerawo n'agamba waayi amazzi bamumanja sente nyingi alina ebyokukola ebirala buli ekintu ekyo kati n'agamba waayi amazzi gano gukankole ki kangabbe bubbi era alaba bulabi wali bagundi balinga abagenze banene abagakolako n'akola ki n'agabba naye ng'amazzi mu Kampala ki wegali mayitirivu nnyo n'enkozesa yaago omusolo banange gavumenti tusabye busabe bambi mufe bambi ku muntu wa wansi.
We have access to clean water, but the problem, we still have a problem of bills. Just because people use water without knowing what will come at the end, how the bill will be. So you find it's so hard. For example, we have Umeme. We faced off Umeme and they brought Yaka. So someone can put a 10,000 on his meter and he knows I'm going to use my 10,000 properly. But right now you find a situation that a bill comes of 80,000, you don't know how you spent the water, you don't know how the bill has increased to that extent. So you find people going to the local springs to fetch that water and leave alone the taps.
But what I see is the commercial users have lower prices than the domestic users, of which the percentage, the majority Ugandans are domestic users. So I call upon National Water to reduce the price of domestic users so that we are able to get at least clean access to clean water in most of our suburbs in Kampala and Wakiso at large. Then also the cleaning of pipes. One day we boiled water in our house, but I saw a lot of dirt below the saucepans, which I saw like is also an issue, because if there's that dirt and maybe there's also rust, it can affect someone's health.
Amazi tukozesa ga mudumu ndi mupangisa sinazimba wekalanga ageta pujegali gabbeyi sigasobola.
We urge the ministry to help us, especially, and educate the people, especially on water treatment, because we need to understand. Some people do not, up to now, people do not know that you're supposed to boil drinking water and take it when it's boiled. Though there are other means, the other means of treating water, they put in those tablets, those medicines, but it is not 100% or even 99% safe. So that is why we are still having cases of malaria up to now, even in kids.
There you are. Good evening, viewers, and welcome to Citizen Voices. I have a panel today of 4. Our regular panelist, Maria Nanyanzi from Sauti za Wananchi. We also have Alex Gisagara, Director Engineering Services, National Water and Sewerage Corporation. We are going to be joined by Robert Mutibwa, the Principal Water Officer, Ministry of Water and the Ministry of Water and Environment. And we also have Felix Twinom Chunguzi, the Assistant Commissioner, Sanitation and Sewerage Services, Urban. Our hashtag is Amplifying Citizen Voices. We are going to be quite interactive. We are going to interrogate issues, and we're also going to glean data from what has been picked from the survey. Good evening, viewers, once again. First and foremost, let me put this question to you, Engineer Gisagara. Ugandans, as we've heard from the Citizen Voices, the opinions we've picked from the streets, Ugandans are quite blessed with many lakes, rivers, and streams, on top of being one of the only 13 countries in the world able to receive rainfall for at least 8 months every year. But a recent study has found that most citizens think their access to water is getting worse. You have quite a blueprint for a 5-year strategic plan as the National Water and Sewerage Corporation that will deliver this service to be in tandem with the lofty ideals of the middle income status. But how can this happen when millions of Ugandans don't have access to safe and clean water?
Thank you very much, dear viewers. Yes, when you have a definition of access to water, what is it in real terms? Quantitative, at the same time qualitative. If you look at the definition of Kampala, our service coverage is above 78%, 79%. And other towns, we have over 95%. But we also have towns, water-stressed towns, municipalities, which have a very big issue, starting from water source. People believe that the whole country is full of lakes, rivers, whatever, springs, and boreholes. But in some places, like the water-stressed areas I'm talking about, you start with the Kato corridor, starting from Tukura via Sembabule, you go up to Masindi, you cross up to Soroti, and go to Moroto, Kotido, Kabong. You will be dreaming when you just say that the whole part, a square meter, is full of water. No. For Kampala, Masaka, Jinja, and Entebbe, definitely it's obvious the lake is full, Lake Victoria, and have done a lot of investments to make sure that our service levels improve, and water in the greater Kampala is where we still have a challenge, where people receive water 6 hours a day, particularly in the northeastern parts of Kampala and some parts of southwestern Kampala, Wakiso and Kachiri. However, we have also put in investments like Katosi big project, our flagship project. We are going to bring on board 160 million of water per day into Kampala subsystem of eastern Mukono and the north and northeastern parts to augment the water supply in Gaba, which is now currently producing 240 million liters per day. So if you look at Kisoro, for example, pumping water from near Congo border to the mountains, how many people would actually access water on mechanical pumping? So we have to do a combination of alternative sources. We have to pump. We have to make sure that even the people who are getting from the boreholes, also we increase the service hours, what we call service coverage. So, dear viewers, the country has a strategic plan. We have targets, goals, and daily, monthly, and activities whereby we have milestones and through the corporate plan to achieve actually access to 100% through a program what we call SCAP 100, accelerated access to the population. And we intend to put 2 taps per each village in Uganda where National Water operates. And so far we have connected over 12,000 villages, and we are still going on. Our target is to make sure that maybe in the next 3 years to 4 or 5 years, with government counterpart funding, it's a cost sharing between the government of Uganda and revenue money from National Water, from your billing, and our billing, your collections, and your payments. So we feel that we should be able to achieve 100% access before 5-year strategic plan. Usually it goes 2023, 2025. We should be knocking there, maybe 95%. Thank you very much.
Yeah, thank you. Robert Mutiwa, who is joining us by Zoom. I hope you can hear me. I hope I'm quite audible. The citizens raised the concern of exorbitant prices, which is quite a sticky issue. How can we ensure that we target a larger clientele that's not going to steal the water, but is able to pay and be able to afford this resource, which, like the UN resolution says, is a human right?
Hello, good evening, listeners, and good evening, viewers. I hope you can hear me. I'm sorry I'm unable to join the meeting in the studio for obvious reasons, but thanks to technology, that wherever I am, we can be able to communicate. Now, the question that you posed is a sensitive one, but I prefer to answer it by making people understand. Normally, when we put a cost, or what I would call a tariff, to a cubic meter or a certain given volume of water, people tend to assume that this is the cost of water. And I would like to make this a little bit clear. Between you and me, we know that maybe a liter of paraffin or petrol costs about 3,000 shillings and above, okay? But that's just 1 liter. And if we look at for example, National Water and Sewage Corporation, they will sell a cubic meter of water, which is 1,000 liters of water, at about the same price. But between you and me, we understand which is more precious. Is it the petrol or the fuel or the water? Now, what the public needs to understand, that the cost attached to water is not the cost of water, but it's the cost of getting the water from wherever it is, treating it, and bringing it to your doorsteps. If I can go down a little bit to the people that are living in the rural areas, we normally require them to make a community contribution on a monthly basis. And this is not the cost of the water that they are taking. No, this is the cost of keeping the infrastructure intact to ensure sustainability of the supply. Therefore, what does this mean? That we need to have an understanding as to why it is very, very important for you to be able to settle your bills in time, so that whichever person is managing the service, whichever person is managing the resource, is able to make sure that you have a full-time supply. I want to say that we have, as government, we have put in place structures at different levels. For example, if we're living in urban areas, you have National Water and Sewage Corporation and maybe other utility providers who have a mechanism of ensuring that when their pipe bursts, they are fixed. When there are other shortfalls in the supply, this is sorted. And of course, this makes our life easier. But we just ask that whoever is using the water is responsible enough to just maybe pay for the cost of getting the service to them. The same applies to our rural population. And I want to still maybe say this even in a different way. We have a guiding principle as a sector, and this was actually guidance from His Excellency, We have to ensure that every community, every village in the country has a source, has a potable water source, has a safe and sustainable and dependable water source. Now, this is not a simple task per se, because you would agree with me that in this country there are some villages that are quite big, but fairly sparsely populated, but also there are some villages that are quite small, but densely populated. So we have to have a go-between. Even when there are some villages that probably have water points, but you realize that because of population density, they are not enough. So we go in and provide additional sources. But at the end of the day, the cost of the water, this is what every Ugandan needs to understand. The cost of the water is actually the cost of getting the service to you, but not of the water itself. The infrastructure, like you heard from the citizens, some of the pipes probably are not okay. So these have to be replaced. And we normally, although we get subsidy from government, but it still needs to be topped up to make sure that our staff and the infrastructure are kept in a good working condition.
Engineer, thank you for that comment, and I agree with you that the cost of bringing water to our households costs quite some money, requires to put in place infrastructure. But I also must say that the cost of extracting a barrel of oil from the ground is much higher than, getting water. To bring in Marie quickly, you've been on the ground and you've conducted a survey. What does your data, what does it provide? What are the statistics on the ground?
Thank you, Emmanuel. Good evening, viewers. So the data that we have does show a number of areas that we can really look at, but I'll start with the challenges, since the citizens' angle from the streets did show that challenges are really the key thing. So what we see here is that the pain points are insufficient number of water points, the distance to the water points, the water is dirty, and this has been consistent between 2019 and 2020, with about the first one, that is 3 out of 10 saying that. But those where we have seen an increase between 2019 and 2020, that is more people were mentioning these problems, were that some water points don't work, that is broken water points. So taking us back to ensuring that every area has a water point. What is it that is happening that some of them are actually breaking, which will lead to inequitable access? Then the cost of water. This is also largely mentioned by those in the urban, because we see that when you compare the rural and urban, a quarter of the urban residents are really talking about the cost of water being a problem, while only 9 out of 100 are saying that. Then the irregular water supply, this has also remained a pain point and has actually increased between 2019 and 2020. For the irregular water supply, this affects both the rural and urban citizens. But to take us back to what we have here in the data, when we look at the main source of drinking water for members of the households in Uganda, we do see that 50% mention that they get piped water in the urban as their main source of water. Then when we look at the rural, this is 16%. So again, we are seeing the inequitable access with a 50% of the urban and then only 16% in the rural. Then when we look at the other sources that they are using, we do see the improved water sources, the likes of the borehole, the protected spring, the protected well, and also a bit of the rainwater harvesting. But maybe what I would like us to talk about is when we are looking at what is an improved water source, or when we are talking about the right to access clean and safe water, SDG 6.1 says access to, it seeks to achieve access for all to clean and safe drinking water. This is described in the target 6.11, which is water is located on the premise, it's available when needed, and is free of contamination. So when we look at those that are getting water from the piped water source, we see that 84% are getting it in less than 30 minutes. So that is really on point, because if at all we are going to look at the improved water sources, if at all someone is going to take more than 30 minutes to get that water, then that ceases to be the point that we are trying to achieve. When they are doing more than 30 minutes, then it becomes a limited improved water source. And we see that for the Ugandans that are not using the piped water and they are using other improved water sources, that is, they are free of external contamination, we see that 68% are getting their water within 30 minutes or more. So we have something hard there that we really need to look at.
Yeah, before we take a break, let me bring in Commissioner. We see an influx. We see numbers of people moving to the urban centers. And this definitely puts lots of pressure in terms of accessibility to safe and clean water. The people in the slums barely have the same kind of facilities that people in much better places. How are you addressing this challenge to ensure that everybody is brought on board?
Thank you, Emma. Good evening, viewers. We are really glad for this show where we can be able to interact and give our views to give our citizens' concerns on water and sanitation. Start with your question. Yes, factors influencing rural to urban migration are diverse and more far beyond what the sector of water and sanitation can control. But we do not have, for us, our goal is to ensure, as Maria has mentioned, that everybody gets access to safe water, whether you're in rural areas, whether you're in urban areas. So our target is 100% coverage. Unfortunately, we have performance targets which are a little bit different for urban and rural. So in urban areas, by the current performance framework, we give a distance of at least 200 meters. When you're in an urban area, you should be within at least 200 meters of a safe water source. When we go to the rural areas, because of the sparse populations, sparse settlements, there we say that if you're within a distance of 1 kilometer, at least 1 kilometer of a safe water point, we say that you're fairly covered by now. Emma, you recall, as we discussed this issue, we just take into consideration, of course, where we are coming from. As far as, or as recently as 1986, the safe water coverage in this country was at only 18%. 18. We had only 37 piped water supply systems across the country. That's about, since 1986. To date, the safe water coverage in the urban areas stands at 70%, about the same, 69% in the rural water areas, and we have over 780 piped water supply systems in the country. So that's quite a tremendous effort, and we believe we are making steps. Since 20, and that was the measurement framework we are using also under the Millennium Development Goals, but since 2016, we have now adopted the Sustainable Development Goal, which requires for water source on premises. And so we are also going to make efforts towards making this percentage equivalently higher.
Commissioner, thank you for that. You say that the supply has grown by leaps and bounds. We'll be taking a break. Ladies and gentlemen, this is the Citizen Voices, and we'll be back to interrogate other issues, including how the pandemic, the COVID-19 pandemic has affected access to clean and safe water. This is Citizen Voices, and our hashtag is Amplifying Citizen Voices. Quickly to bring you in, Engineer, the COVID pandemic underscored the need of water and sanitation, basically, to be able to control, basically, the spread of the COVID pandemic. People needed water to wash and have hand-washing facilities. How did you ensure that during this very critical time, households were not disconnected, for instance, because of a mere bill of 20,000 shillings?
Thank you very much. Dear viewers, citizens, It was a very difficult time since last year, and when the COVID pandemic set in, we had to work with the Ministry of Health and other key stakeholders to ensure that the spread of COVID, we had to participate in how to break the chain of infection. And at the same time, there were so many restrictions of access, logistics, and supply of inputs, which are very paramount for the water treatment processes. And as you mentioned, of course, it comes back to also the revenue collection exercise, billing. The instruments were issued. Actually, the first critical announcement is how many people should sit in an office, how many people should come and visit your office, the interface with the customers, because when you don't interface with the customers, definitely there's a big gap in the service delivery. And the critical one was no disconnection order. It also applied to the powers, all utilities. And you supply water, you bill, but you don't access the premises, how to convince the customer that this is right to bill, the meter readings, and don't touch the pipe. And also the issue of maintenance, O&M, operations. When the pipe breaks, do you mobilize enough staff to work? Because you work 24 hours, 7 days, the restrictions of the curfew, and you're going to stay on a pipe at midnight, 3 a.m., 4 a.m., to ensure that the broken pipe does not cause damage to houses, to people. Another critical factor was the markets. There's a lot of markets, population. The markets were also restricted to work, but the numbers, hand washing facilities. So National Water first front line was to make sure that we have more access, as actually before we were talking about one tap, for example, in Nakasero 3 taps, but we had to make like 10 taps in one market, and dispensers were put in place. Hand washing, that was cost sharing, the issue of soap and all that. Then there are areas out of Kampala and other towns where the intermittent water supply, as you mentioned, the access. We had to actually partner with like MTN. We bought water bowsers of 10,000 liters, 20,000 liters to cater for collection and transporting water to most stressed areas so that we break the chain of infection. We installed also the tanks and the products which are on market, Gentex, Crestank and others. They contributed. We put in many tanks and people continue to have supply. Ultimately, the effect was the billing, revenue collection inputs, because you can't operate 260 towns without income. We dropped almost to 50%, 40%, 40%, 50%. We are in a recovery plan now. We are almost coming back to normal. And the customers, I want to thank you, the citizens, have accepted to pay without engagement, without any hassle of coming to your gates and threatening to disconnect you. We just use the messages, the mode of actually of communication. The analog system collapsed. We are using only digital, and it works. So we thank the public for accepting that method of work, but also had a challenge of floods. When the time of COVID set in, there was a lot of rainwater precipitation from the rainfall, and some parts of Rwenzori West, particularly Pondwe, Kasese, Lira, Pakwach, many areas, the infrastructure was washed down. And of course, our famous Bududa, the Sono, and the Sironko, even up to today, they are still affected up to Roro. So emergency repairs, emergency supplies, it had a very big issue. But we thank the Uganda police and other people who are in security who allowed us to work at night, 24 hours. I remember I camped in Mpondwe, Rwenzori Mountains for 10 days without any interaction with the people obstructing us. We put on a mask, protective wear, you get the citizens, and you go and work. So I want to thank the citizens for the support you have given to National Water, and we are improving. We shall continue improving. What's most important, to give you quality service with good quantity and consistency in service delivery. Thank you very much.
Yeah. Robert, I hope you're still with us on Zoom. To ensure that water reaches every household, it must be matched with a robust infrastructure. Robert, I hope you can hear me. I hope I'm audible enough. Have we prioritized this issue of infrastructure?
Well, I think, in my opinion, we will need to understand, first of all, when we talk of infrastructure, it differs. I think Alex hinted about this a little bit before we went for the break. Over the country, we are having a mix of technologies, technology options or approaches that we use to make sure that every Ugandan receives the service. And if we look into maybe the urban areas, we're using piped water systems. If we go into the rural areas, we're using point water sources. But all this collectively is what we'll call infrastructure. Now, it's not actually a question of whether we're prioritizing infrastructure, because this always appears in our ministerial policy statements. Every year we do budgets and work plans, and the infrastructure forms the core of the output that is contained within these documents. The key thing here is different areas require different kind of infrastructure to deliver the service. Actually, if you follow closely what we're doing as a sector, it's not anymore, in fact, about putting up infrastructure, but we're looking more on service delivery. Because you agree with me, a pipe of water coming to your house would be useless if there's no water flowing. It's just like having a king without a kingdom. So the pipes or the taps or the boreholes need to have water flowing. So we are going beyond even looking at putting in place infrastructure, but also ensuring that the infrastructure is serving the purpose for which it is intended. Now, between you and me, I would say, yes, we are prioritizing this, but the question at hand would be, how big is the resource envelope that the sector has against the national budget, and how much can we do with this? I'll give you a little bit of the statistics. In the country, we have over 133,000, about that, 133,000 point water sources. And when I say point water sources, I mean I'm looking at those technology options that are being used to provide the people in the rural areas with safe water. We have boreholes, we have shallow wells, we have springs, we have gravity flow schemes with taps, and then we have also rainwater harvesting tanks. So all these put together, there are more than 130,000 point water sources. It is this infrastructure that has given us the service coverage, which Engineer Felix did mention earlier. But we contend with the fact that this is not sufficient, especially when you look at the indicators that are being redefined by the sector development goals, the SDG, and Marie talked about this SDG 6. The key requirement here is that water is brought to the doorstep of the user. And as a sector, this is something that we are now trying to work on, especially in the rural areas. For example, we are now working on saying we want to get the water from the head of the person. In other words, you notice in the rural areas, everyone is carrying water nearly on their heads from point A to point B. How can we get the water from their heads into the pipe to where they want it? So while we're looking at this point water source infrastructure, the sector is looking at upgrading and providing a better service through ensuring that we bring the water closer to the user. And when the water is closer to the users, the indicators, the facts that Marie was putting forward, the 30 minutes of waiting walking the water source, the indicator of maybe a service area being 1 kilometer, we are working on reducing that. And when that is achieved, it means infrastructure has been put in place. But as for me and the sector, we're even looking beyond having infrastructure, but having a service. Because when you have the service, by default, the infrastructure will actually have been put in place. So I think that this is the way that we are going in as a sector, and we should be able to achieve that. We, of course, need to have support, of course, of the wananchi in this. And why the wananchi become very, very important in this is, one of the challenges that we have as a sector is that some of the water infrastructure we put in place gets damaged by somebody who probably thinks otherwise, or maybe it has run out of its lifespan. Because, once you buy even a vehicle or a bicycle or a motorcycle, you know that it will not run forever. But are we also taking enough time to look after the little infrastructure that we have? So we look at, and we have a keyword here saying that let's keep the functioning facilities functional, and then we start looking at those that are not functioning and bring them to add on to the stock of the functioning.
Thank
and
you.
Here the wananchi also play a very important role in making sure that we're keeping our stock all contributing to the service delivery.
Thank you so much. Thank you so much for that, Robert. To bring in Marie, the question of safety remains a key concern. The WHO, World Health Organization, the UN, observes that about 19% of Ugandans rely on unimproved or surface water for their daily needs. They get water from sources such as streams, ponds, and unprotected hand-dug wells. Basically, what does your research on the ground indicate in regard to this subject?
Thank you, Emma. So what we have from the research that was conducted last year in August, it does show that overall, 26% of Ugandans are getting their water from a piped water source, and then 54% are using other improved water sources. Now, other improved water sources could include the borehole, the protected spring, the protected well, and also rainwater collection. What makes it improved is that it's protected from contamination, especially fecal matter. Now, again, we are seeing that when it comes to the unimproved sources, we see that 13% of our population is using other unimproved sources, and 8% are collecting water through the surface sources. But when you look at the 8% and 13%, plus also those that are using improved sources, we still see that 36% of our population do nothing to the water before they drink it. So they will take it without boiling it. It's only 57% that say that they boil their water. So that is also an area that I think probably in the long run, we could be able to sensitize more citizens on what they need to do to ensure that that water is treated. But then to go back to a point that was mentioned by Engineer Robert, that you need the wananchi also taking a role, being active. We have seen that when we asked about the local water management committees within their location, that only 50% of our population are aware that those exist. So when you talk about the challenges that citizens have around the broken water points, how do we ensure that these citizens play an active role when they are not even aware that they have a local water management committee? So I think it's important that we continue to emphasize that citizens need to take an active role, find out what that committee does, and take part in those meetings so that you're part of the protection of those water points that we have in place. But overall, from the different sources that Ugandans are using, we do see that clearly there is inequitable access, where in the urban they have access to piped water, and in the rural they are far less. And also in regards to the other improved water sources, in the urban it's 37% that are using other improved water sources, and in the rural it's about 60%. But again, the rural population is the one that suffers the most in terms of taking longer to collect water. A number of them take more than 30 minutes to collect water, which now derails us from the SDG that we are talking about. During the break, Engineer Felix was talking about the ministry now looking at a target that by a certain point they should be able to have access to water on premise, that is now a priority. And I think that is really good to hear that there is a number that is being set to ensure that all Ugandans have access to water on the premise.
Commissioner, to bring you in, we have quite reliable rainfall, and this is perhaps something we take for granted. Between 2015 and 2018, Cape Town in South Africa lived under the specter that their taps would run dry. They called it, I think, day zero, because basically there's a nexus between the drastic effects of climate change and the supply of rainfall and drought and all these kind of things. Are we carrying out enough civic education to see that we can bring to halt activities such as illicit logging, so that we can continue to have reliable rainfall. We're only left with about 20% of forest cover.
Yes, thank you, Emma. Of course, the effects of climate change are global, and unfortunately, they have a higher impact on least developed countries like ourselves, who have limited capacity to build bigger infrastructure that is, which is climate change proofed. So we have to do everything possible within our means to, one, to improve our adaptation to these effects, that they do not swallow us up, and also two, that we also do our share to make sure that we do our contribution to prevent the climate change scenarios. We have a new department, a climate change department within the ministry, which is doing promotion of climate change activities within the sector, but in all sectors. The Parliament also passed a resolution that we have to all government programs in all sectors. They must have activities for climate change proofing activities, and these are being supported. Now, specifically in the water, this, as I mentioned in the case of South Africa, it's actually in the topics now, it's affecting us in two ways. One way is the extreme good, but both are not good, which Engineer Alex talked about. You have cases of increased flooding. So you have flooding, which washes away your infrastructure. Yes, you have the water. We've had cases where the intakes are washed away, in the Bundibujo, in the cases of Bududa, he has mentioned that. Then we have sometimes the opposite, where we have drought now. You have no water, the lake levels recede, and then we have to build more infrastructure to get water from in the lake levels. And many of our water sources we use, some of them are boreholes, as you mentioned, they tend to dry down, the water table goes down. And then through our structures, we call umbrella structures, our water and sanitation development facilities, we try to build more facilities to make sure that we get the water deeper so that we mitigate these effects of climate change, that we may continue to have water despite the effects.
Engineer, as we wrap this up, just within a minute, so that the rest can also have just a minute to conclude this subject. What do you need as the team, the technocrats at National Water, to ensure that in the next year, in the next decade, every Ugandan has access to clean and safe water?
Thank you very much. I think, as I put it very clear, the investments which are ongoing, like Katosi, it's a big project. We also have the Kagera project. Isingiro people, you are listening. We have also the northern Uganda. We have Guru. We have done Arua. We are coming to Lira. We are coming to Soroti and Tororo. We know the areas where you are water stressed. So National Water Strategic Plan is very aggressively addressing the water quantity and quality in terms of production and the network for Kampala, for example, upgrading of Kampala. We secured about 70 million euros. We are now almost at tender stage. Very soon we are coming to again dig out the towns. Masaka, they're on board. We are going to pump water from Lake Victoria and remove that swamp called Nabajuzi, which is very difficult to treat, and many programs on board. And we thank management and board of National Water, Ministry of Water and Ministry of Finance and Parliament and the government of Uganda for supporting National Water.
Thank you, Engineer. Mary, in a minute, please. Okay. What can we do as this civil society to basically carry out civic education in regard to bringing the grassroots on board about access to clean and safe water?
Thank you, Emmanuel. So I believe as civil society and also for fellow citizens, it's important that we get to know what is happening on the ground, because all that change that you need to happen really starts within your village. So it's important that we get to know who are on the water management committees, how are they functioning, so that we play an active role, because it will not make a lot of sense when taxpayers' money is used to set up infrastructure and then other citizens break that. So it's important that we continue to get involved, because we have seen that between 2019 and 2020, the service delivery in terms of water, according to 4 out of 10 Ugandans, has improved, and they're satisfied with that.
Commissioner, once again, the right to access to clean and safe water is a human right. And yet
True.
we know that to put water in every household, it requires financials.
Yes.
What do we need to do to see that we reach out to more households? Within a minute, please. As we
Yes,
wrap
thanks,
this up.
Emma. I mean, the only magic bullet to this is finding the resources. To all of us doing what we have to do, civil society has been a very good advocate for us, both internally and internationally. Our development partners have been very supportive, the European Union, the World Bank, African Development Bank, other countries, to make sure that we realize the resources. Emma, in 2019, we did a strategic sector investment plan study where we estimated that we need about 9 times the current resources that we have in the sector to be able to achieve this target of safe water supply to every household. We currently have a total envelope of about 1 trillion Uganda shillings as a whole sector, water and the environment, but we expect to reach these targets by 2030. We must be able to mobilize up to 9 trillion shillings every year to make sure that then we shall be able to achieve the targets.
Thank you very much. You've been watching Citizen Voices, and we've been joined by a panel of 3 distinguished technocrats and our regular panelist, Marie Nanyanzi. I've been your host, Emmanuel Mutaiziwa. Have a good evening.